from whatever part of the country
Whichever
you
part
call.
of the country that you call from, they will be able to solve your problems.
Okay.
Yes.
What are they likely to do? Walk me through the steps. If I'm at a hospital
Yes.
and I'm being told that my name is not found in the system, are they going to tell me, Patia, uyo daktari simu?
Pana, because they have been trained on how to handle the issues. It depends on what your issue is. They will be able to sort out, and even if they need to escalate, they will escalate it to the branch manager, to the regional manager, or to the HQ. So they have the matrix on what to do for each problems that you face.
Okay.
Yes.
When was this call center established?
It has been there.
Since when?
Since NHIF has been in existence.
Okay.
Yes.
So how come you didn't think about using it by the 30th of September? I'm still coming back into
yes.
what were you people doing up to the 30th of September?
The people who need to use, many of them know this call number.
Patients are the ones who need to use.
Yes.
Many of them don't know this number, Doctor.
That's what I'm telling you. Now what we want to do is to simplify this and make it a smaller number. Like maybe 100, 147, 741. A simpler version that someone can easily remember when they have an issue. So that will take us some time, but hopefully we will move away from this, because recalling this number
it's a long number.
Yes,
so
exactly.
Is this number displayed at the health facilities? Because one of the things that you do
is
you walk into a health facility, at the first point of call in the health facility, you say, you have an issue with SHA, this is it. You want to talk to a SHA officer, maybe there's a SHA officer stationed here, or this is the number to call. Is it there?
In the health facilities? Not yet. They haven't yet branded because this is for SHA. It's not for the hospital. This is for SHA.
Exactly.
Yes.
And everybody who is going to a health center across the country is a SHA member.
Yes.
Now it's not about NHIF.
Yes.
Everybody.
Yes.
As long as you are 18, compulsorily, you are a member of SHA.
SHA, yes.
So you go to any health facility in this country, you're most likely going to need.
But if you register, you will find that in your profile, that number. If you go to, you will find the contact, which email to use, which call center or number to call for help. Have you registered, Eric?
I have.
Have you gone to your Afya Yangu portal?
I went to Afya Yangu, he told me the password
your profile. Is wrong. It said your password?
But it's the wrong password.
Yeah, you renew, because you see, you know that's your data. The same way you keep your PIN for M-Pesa secret is the same way. So you say reset password.
Okay.
And then you reset and you restart afresh.
And at what point will I see this number? 800 720.
And that's why I'm telling you, we want to change this to a smaller number. Then that becomes a much easier number to remember, even offhand. That you don't need to look for it anywhere. And you don't need anyone to display it anywhere, because it's a number that you easily know. You can easily remember it's 147. The same way you've seen we are saying star 147 hash to register. It's the same way we will have a smaller number that will say 147 call.
I don't know if you're getting the gist of where I'm heading.
Yes.
This conversation I'm asking, that you've had a year to prepare. Since the moment the laws were signed in Parliament by the President, they became law. And the President launched UHC in Kericho last year in October.
Yes.
It's been a year. It's been a year establishing the SHA board, you joining the board. It's been a year of transitioning from NHIF to SHA. It's been a year of getting everything else, all the ducks in a row. And it's you who decided that 1st of October was going to be the date. Not the law.
Yes.
So when you decided 1st of October was going to be the date,
so do you know what
things did you put in place to make sure that you're going to have a seamless transition?
A lot of things. The first thing that we put in place is the regulations. A law alone is not enough to implement. So that year, part of it was in court. So there was nothing that was ongoing. Because if the court says it's unconstitutional, there's nothing that you can do. Second part is to work on the regulations, public participations, across the counties with the professionals. Third, we had to come up with the benefits and tariffs, which needed to be gazetted. That also needed stakeholder input. Looking at the budget, what do you have? Which one do you optimize? Which one is more important than the other? All are important, but based on the severity and based on the money that's available, you have to prioritize and say, we will start with this and not this as we move forward. So that year, a lot has happened. The second thing is, the fourth thing is how to transition. You know, you're establishing a whole new parastatal. So you have to do the whole HR instruments. Third, what has happened also, there was a transition committee also to do asset verification. So a year sounds too long, but when you realize what has happened, then you see a lot more has happened in those short period of time.
In all these things, was there communication?
Yes. It's maybe I understand you might have seen it many times because these things have been published. Even the regulations have been published in the newspapers. The tariffs have been published in the newspapers. For all these stakeholder engagements, when the transition committee was gazetted, it was also published and it was in the newspaper. So the question is, what kind of communication and is it everyone who hears it? Because it also depends on you people. And I have heard today morning City saying that there has been a lot of challenges, but all of a sudden the impeachment is the one that is in the center stage. But there is a lot of more important news that we keep on dropping. So yes, these things have been communicated, and that's why you also said, I was here, the presidential advisors were here. All this period, the CS, the PS, the former chair, all came here to just keep on communicating what are we doing and what's happening.
Actually, what you're saying is that it was inadequate. Because if it was adequate, there would be questions, yes, but there would be questions that are not related to the non-functionality of the system. Why am I saying this? If there's a power outage, if there's a glitch in the system, and you have all the documents that are required, that is something that is easy to sort out. But when everything that we have heard arises from people who have actually gone to hospitals and they are saying we cannot access, it can be a glitch. It can be a teething problem. But when you talk about how it is you've communicated to the provider to be able to give the information, that information should also have been given to the person who was seeking the service. Because if they were clear about it, then the hoo-ha that we heard would not have arisen, because it wouldn't have been you explaining, because you've already explained to the provider. The provider would have said, we are in communication with SHA, and this is what needs to be done. Now, this number that you're speaking of would have come in very handy, because then one knows exactly who to call. Because even right there, when you have this problem and this glitch, you can call and say, look, I'm experiencing this particular problem. What do I do? How do I go about it? Now, if we do not have information as to how that particular chain of events could have moved to the point where the health seeker, the person who is seeking healthcare has, or his issues have been resolved, then the system still needs looking into. That is as politely as I can put it.
Thank you, City. Do you know, even after today, out of the 56 million Kenyans, maybe 1 million are the ones who will know this number?
True.
So that tells you that there is no enough messaging or communication that will tell me will reach every Kenyan.
But you know, there are ways of thinking about it. And that's why I said,
no, that's why I'm coming. I'm coming.
If it's at the health facility,
let me finish so that we are on the same page.
Okay.
It can't be that this thing will be let me reiterate again. This number was for NHIF. We haven't even changed it.
We didn't even know it.
Thank you.
Me, I didn't know it.
Thank
all.
you. Now that tells you that there is only so much that you can communicate forward. And that's what we want to change, because even communicating this is a big challenge. 0800726601. It's not an easy number to remember. In as much as it's a toll-free line,
Yes.
it's not an easy number to remember. So we rather have a simpler number that we can easily say and everyone knows, SHA number. So for me, something like the 147 becomes an easier number that anyone can know. Register *147 hash. You have a problem, dial 147.
And
That for me answers some of the challenges that we have faced.
Exactly.
And
and by the 30th of this thing that you're saying today with so much clarity, Daktari,
yes,
is I'm sure you'd have had the same clarity on the 30th of September. And by then, as you're thinking, we are going to roll out this system on the 1st. And we are dealing with an entire population of 56 million Kenyans. And we want as many Kenyans to know what this thing is all about, for them to understand. One of the things is we have *147 hash. Can we also make it a toll-free number, 147? Clear. Can we start talking with our service providers, the mobile service providers, to give us the 147 number so that it can be the SHA number? 147 is your SHA number you can call. *147 hash is your USSD code. You can deal with SHA. Those ones. And then in every health facility, can it be clear? This is how we shall transition to SHA. From the 1st, when you come with your NHIF card, do not worry. You will be moving into SHA. If you're a contributor into NHIF, don't worry. You will be migrated to SHA. People have been receiving messages last week that you have been migrated, and they're saying, why are you forcing me to migrate into SHA? It's because they don't know. It's a lack of understanding and knowledge that this was what was going to happen anyway. If they had gotten a message, dear member, come the 1st of October, we are going to migrate you to SHA. People would be knowing. When you're getting all this pushback, Daktari,
yes,
it's because you thought about everything else, but you didn't think about the user.
The communication.
If you didn't think about the user now is lost. And the user is not just the patient. The user is also that person who's working in that health facility, who has not been communicated to.
We have done, I think, almost over 10,000 users that we have trained over the last 2 weeks. And these are from providers. We have trained over, and that's from just the private sector. And we have trained many other end users from the public sector as well, because the public sector wasn't even prepared as much as the private sector was prepared. So in terms of, is it adequate? Maybe not. Is it something that should come to an end immediately? No. It's a continuous process. So we'll continue training, we will continue communicating, we will continue simplifying the processes that were there. And these are some of the issues. Like you see, this number has been in existence forever. The call center has been in existence forever.
Yep.
But you have been a member for NHIF for how long?
Many years.
Have you ever known you have a toll-free number to call if you have an issue?
Nope.
And that is the difference between NHIF and SHA. And that's what we will need to now inculcate. And that's the reason why we have everything of SHA is transparently done.
Okay. Now you mentioned this number.
If you look at the tariffs and the benefits, yes, City.
The question I want to ask is,
yes,
when I call this number, what exactly will I get?
You will call, not to ask them how they are feeling, but you will call asking them what your issue is. So if you have your number, your card, and you have an issue in terms of how do I contribute, for example, where can I get services? It's a second thing. Is my contribution up to date? They will be able to answer all your questions. where can I get these services?
And I am
which provide-
assured that when I call, there'll be somebody who will respond.
Yes, yes.
And if they don't respond, what do I do?
In terms of the line is busy, or in terms of the
or hold on,
or
we're soon connecting you to whatever it is you're supposed to be connected to, that sort of thing.
So the second alternative that you have is when the toll-free number is not working, is the branch or Huduma Center, where we have staff. So they will be able to answer the questions that you have.
And you
So you
trained
have-
all these people.
Yes. And it's a continuous training to train them on what are the issues, how to solve them, how to escalate, what are the challenges. And it will take some time. Nothing, I'm not saying we have a perfect
Group
system.
Limited. On
No, nobody's expecting a perfect system.
Yes.
But as we get to the top of the hour, the question I want to ask, does SHA have a communication department?
Yes, it does.
There's a reason why I'm asking this question.
Okay.
There's a reason why, and we will probably proceed with it when it gets to the next hour.
So we'll open the phone lines for anybody who has a question, of course, to ask the chairman of the Social Health Authority. And the phone lines, of course, are 07206. What's our number?
Start.
Okay. I'm glitching. The number will be shown by Lydia online. I'm just thinking about this 0800 720 601, which is. Okay, our number will be on the screen. Call that number. The chairman of SHA is our guest this morning. What issues have you faced as you are accessing services? Or what information would you like clarity on? For example, maybe you received a message that you've been told you've been migrated from NHIF to SHA. What does that mean? Would you like some clarity on that? If you go to a health facility today, a level 2 facility, are you going to require a SHA? Do you need a SHA card? Do you need to register for your biometrics? And how do you do that with biometrics? And all this kind of information. So let's engage with him. It's 9 a.m. News time first, then the calls later.
Sugar and spice and everything nice. Spice FM.
Spice up your life.